Here we're going to start quite an extensive review of the anatomy of the hand and the wrist. We're starting with all the structures in view, but again, this is not a complete anatomy lesson of the hand and the wrist, as many of the ligaments, both intra and extracapsular, are not in view, and certainly there are still many nerves and vascular structures that are not included in this tutorial. So here we are, we're zooming in on the dorsal aspect of the wrist. We're focusing here on the extensor pollicis longus tendon. You can see how it makes almost a right angle as it crosses over the wrist and heads towards the dorsal aspect of the distal thumb. Also, you can appreciate the superficial branch of the radial nerve, which divides into medial and lateral branches, and that further subdivides as it goes into the thumb and the index finger. You can also appreciate an extensive venous network on the dorsal aspect of the hand and the wrist, and this is quite variable between people. And while making this tutorial, I really just took what was most commonly seen and tried to reproduce that in terms of the venous anatomy. Now we're going distally. We can appreciate the sagittal band and the oblique band over the MCP joint of the fingers. And if the sagittal bands are torn, that can cause subluxation of the extensor tendon, which you can see with flexion of the fingers. You can appreciate the various ligaments around the fingers, including the triangular ligament, which is over the dorsal distal aspect of the hand. And now we're rotating, we're getting a more head-on view of the dorsal aspect of the hand, and you can see how the extensor digitorum tendon bifurcates into the lateral slips, which then go distally and converge on the base of the distal phalanx on its dorsal aspect. You have that central slip, which inserts on the dorsal aspect of the proximal middle phalanx. Also, you can appreciate the oblique retinacular ligament, which traverses over the PIP joint, which goes from a volar to dorsal direction. Here again, we're rotating and we're getting a nice view of the extensor digitorum longus tendons. You can appreciate the juncturae tendinum, which are essentially bridges between the extensor digitorum longus tendons. And again, there appears to be a significant amount of variability between these structures, and I attempted to depict the most common pattern. You can see the dorsal interosseus muscles, and also you can appreciate the extensor tendon sheath. Some of the tendons, they're popping out as a sheath, and that's just a technical error in the reproduction of this model. Now we're rotating, we'd appreciate the Palmar carpal ligament, and here we can get a really good view of the superficial branch of the radial nerve as it divides into a lateral and medial branch, and then that medial branch further divides into dorsal digital branches. All these branches go to the thumb and the index finger. Also, you can appreciate the abductor pollicis brevis muscle, part of the thenar musculature. Now we're rotating, and we can see the radial aspect of the wrist. You can appreciate the radial artery and veins, as well as the ulnar artery and veins, and note that there's basically doubling of the veins around the arterial structures. Here again, we're getting a look at the abductor pollicis brevis muscle, part of the thenar musculature. Also see the Palmaris brevis muscle at the ulnar base of the hand. Appreciate the Palmaris longus tendon, that superficial tendon, which essentially spreads out distally over the 2nd through 5th digits, and it blends in with the palmar aponeurosis. Here we can see a pretty good view of the recurrent branch of the median nerve feeding the thenar musculature. And again, you can appreciate the abductor pollicis brevis muscle. Underneath that, you have the flexor pollicis brevis muscle. Also, you can appreciate the adductor pollicis muscle, which is divided into the transverse and oblique heads, and it's actually supplied by the deep branch of the ulnar nerve, not by the recurrent branch of the median nerve, which is an error in this depiction. Its insertion is on the ulnar side of the base of the proximal phalanx of the thumb. Here we can appreciate the transverse fasciculi, the palmaris longus tendons, which binds those tendons together. Distal to the MCP joint, you can get a good look at those again. Here we're kind of focusing on the pulley system, where you have A1 pulleys going all the way to A5 pulleys, as well as the C1 pulleys going all the way to C4 pulleys. The A1 pulley is the pulley most effective in trigger finger, where you have thickening of that pulley, and a lot of times your injection is focused over that pulley, and sometimes that pulley needs to be released if you have refractory trigger finger. Appreciate the broad A2 pulley that is over the proximal phalanx. And now you can also appreciate the lumbrical muscles, which are the most palmar muscles in the hand. Underneath that you would have the palmar interosseus, and then you would have the dorsal interosseus muscles. Again, we can see those transverse fasciculi, the palmaris longus tendon. And you can imagine if any of these pulleys are injured, there can be bowstringing of the flexor tendons, which is essentially when the tendon lifts off the phalanx more than 1 millimeter. Going proximally now, we can see the palmaris longus tendon again. Also can appreciate the superficial palmar venous arch, as well as the superficial palmar arterial arch, which are fed from the ulnar artery and the radial arteries. Appreciate the flexor pollicis longus tendon, kind of making a pretty sharp curve going from the wrist towards the thumb, similar to the extensor pollicis longus tendon. Now we're removing some of the layers. We can appreciate the transverse carpal ligament, and this is the ligament that is released in refractory carpal tunnel syndrome as it causes impingement over the median nerve. Again, we can appreciate the recurrent branch of the median nerve branching off distal to the transverse carpal ligament. Also, you can appreciate the flexor carpi radialis tendon, which is not in the carpal tunnel. It's superficial to the carpal tunnel as it is over the transverse carpal ligament. Now we remove the transverse carpal ligament, get a better view of the median nerve in its course, and also we can appreciate the radial and ulnar arteries and veins. Seen are the transverse fasciculi of the palmaris longus tendon, as well as the thenar musculature, including the adductor pollicis muscle. Again, you can appreciate some of the lumbrical muscles. Now going distally again, removing some of the thenar musculature as well as the transverse fasciculi of the palmaris longus tendon. And we're focusing on the flexor tendons, where you can see the flexor digitorum superficialis tendon that bifurcates into medial and lateral slips, which insert on the volar base of the middle phalanx, and then the flexor digitorum profundus tendon continues distally and inserts at the base of the distal phalanx. If the pulley system is injured, you can appreciate how these tendons would bowstring with finger flexion. Now we're going a little bit more distal and zooming in here just to get a better appreciation of these tendons. Also, you can appreciate the proper palmar digital nerves from the median nerve, and then you have proper palmar digital nerves from the ulnar nerve as well, going to the fourth and fifth finger. You can appreciate the accessory collateral ligament and the proper collateral ligament, which you find on either side of each joint in the hand. The accessory collateral ligament attaches on the volar plate. So you can imagine with sprains of the finger, they can also involve the volar plate if that accessory collateral ligament pulls on it. Here again, we're focusing on the proper palmar digital artery veins and nerves. And now we're going proximally and we're removing the flexor digitorum superficialis tendons, get a good view of the superficial venous and arterial arch, get a good view of the median nerve, unobstructed by any overlying structures. And you can also see the underlying flexor digitorum profundus tendons underneath the median nerve. You can see how the median nerve branches out into the recurrent branch of the median nerve that feeds the thenar musculature. And again, you can see the lumbrical muscles. Now we're going distally and we're removing all the flexor tendons. You can appreciate the volar plates on the volar aspect of each of the interphalangeal joints of the fingers. You can see the collateral ligaments, how the accessory collateral ligament feeds into the volar plate. And again, you can appreciate the proper palmar digital artery, nerves, and veins. So you can appreciate the joint capsule underneath the collateral ligaments and volar plates. Now we're going back proximally, removing the lumbrical muscles. And again, you can appreciate the adductor pollicis muscle. And now we're looking at the palmar interosseous muscles. As you follow the median and ulnar nerves, you can see how they first split into the common palmar digital nerves, and then they split further into the proper palmar digital nerves, again coming from the median and ulnar nerves. Now we're going proximal. We're removing the flexor pollicis longus muscle as well as the adductor pollicis muscle, and we're rotating, and we can see the ulnar aspect of the hand. And again, we can appreciate basically the extensor hood, which is made up of the sagittal bands and the oblique bands of the extensor hood, which are separated here in this model. However, in real life, these are blended together. Also, you can appreciate how the cephalic and basilic veins go distally, and those essentially are feeding this dorsal venous network on the top of the hand. And again, there's a significant amount of variability in these venous structures between individuals. Now we're getting a good view of those dorsal interosseous muscles. And again, the dorsal and palmar interosseous muscles, those tendons both feed into the extensor hood. Again, blended in real life, but here somewhat distinguishable. Note the transverse retinacular ligament, and this ligament prevents dorsal subluxation of the lateral bands. And the interosseous muscles feed into the lateral bands on both sides of the digit, and the lumbricals actually feed in on the radial side of the digit. Also, you can appreciate the triangular ligament as well, which also provides stability for the lateral bands. Here we're focusing on the oblique retinacular ligament, which is thought to stabilize the PIP joint, as it originates from the base of the proximal phalanx and courses obliquely and ends on the dorsal aspect of the distal phalanx. Also, you can note the dorsal-cutaneous branch of the ulnar nerve, which comes from the ulnar nerve, which is on the volar aspect of the forearm, and then it slips under the flexor carpiomaris tendon, and then it goes towards the dorsal aspect of the fifth digit and the ulnar aspect of the fourth digit. Again, you can appreciate the extensor digiti mimini tendon, which is the fifth extensor compartment on the dorsum of the wrist. Also appreciate the dorsal venous network again and the basilic vein on the ulnar aspect of the wrist. Now we're moving the extensor digitorum tendon, and you can see the extensor digiti mimini tendon and the extensor carpionaris tendons that were just removed, as well as the extensor indices and extensor palmaris longus tendons. And now we can get a pretty good look at the dorsum of the wrist. We got the radiocarpal joint capsule, we got the midcarpal joint capsule just distal to that, and then you have the various carpal metacarpal capsules. The fourth, fifth carpal metacarpal joint capsule is one capsule involving those two metacarpals. Then you have a single third carpal metacarpal joint capsule, and you have a single second CMC joint capsule, as well as a first CMC joint capsule. Here we are focusing in on the first extensor compartment, consisting of extensor pollicis brevis muscles and tendon, as well as the abductor pollicis longus muscle and tendon. Another good view of the superficial radial nerve. The veins appear to be floating in space as the underlying musculature was removed. Now we're removing the second extensor compartment as well as the extensor pollicis brevis muscle. We're going distally over the dorsal of the hand. Here we remove the interosseous muscles and we're going proximally. We can see the midcarpal joint capsule and the radiocarpal joint capsule, as well as the carpal metacarpal joint capsules as well. You can also appreciate the dorsal carpal arterial arch and the dorsal metacarpal arteries branching off that. And again, you get a good view of the superficial radial nerve with the various branches. Now we're removing the neurovascular structures. We can get a nice view of the abductor pollicis longus tendon inserting at the base of the first metacarpal. Also, we can get a glimpse of the insertion of the brachioradialis tendon as well over the dorsal radial distal radius. You can get a glimpse of the distal radial ulnar joint capsule as well as the radiocarpal joint capsule, as well as the midcarpal joint capsule. Now we're rotating over the radial aspect of the wrist, and we can appreciate the joint capsules from a volar perspective, where we can see the radiocarpal capsule and the midcarpal capsule as well. You can appreciate that broad insertion of the flexor carpio-radialis tendon, where it inserts on the bases of both the second and third metacarpals on their volar aspect. Again, we can see the broad tendon of the brachioradialis tendon. Here we get a good view of the lumbrical muscles. The first lumbrical muscle should be, again, textured like a muscle with red texture. Unfortunately, this came out as white, so it's not just a pure tendon. It is a muscle that obviously fades into a tendon, just like the other lumbrical muscles. We can also appreciate the flexor carpio-ulnaris tendon. And now we're removing the lumbrical muscles. We can see the oblique retinacular ligament from a volar perspective. Also get a good view of the volar plates with the check rein ligaments that attach the proximal aspect of the volar plate to the underlying phalanx. Also, you can appreciate the accessory and proper collateral ligaments on the side of each of the joints and the fingers. And also we can see here the underlying joint capsule around each interphalangeal joint. We got a good view of the volar aspect of the carpal metacarpal joint capsules. So note that the flexor carpio-ulnaris tendon inserts on the volar aspect of the pisiform, the hook of the hamate, as well as the base of the fifth metacarpal joint. And again, you can appreciate the flexor carpi-radialis tendon with insertions on both the proximal volar base of the second and third metacarpal. Here we can see the pronator quadratus muscle that was just removed. Again, here's a view of the capsules, and these capsules in real life are really hard to distinguish from each other as they kind of all blend into each other. We're trying to kind of decipher them out in this depiction here. And here we're having a side view of the radiocarpal joint capsule. You can also see the midcarpal joint capsule, and there's also a piso-triquetral joint capsule between the pisiform and the underlying quitretrum bone. Also, we can appreciate some of the ligaments within the wrist that are actually underneath the capsule, which we can appreciate here as well. This tutorial does not go into detail about the ligaments of the wrist, however. Again, a nice view of the dorsal aspect of the wrist with the radiocarpal joint capsule and midcarpal joint capsule, and we can again appreciate the various bony structures in the wrist. A little bit of technical issues here, as you can note that one of the intracapsular ligaments are kind of poking out here under the ulnar. That's a glitch technically. There's a little bit of ruffling of the CMC joint capsule where you can see some lines. Again, that's just a technical issue. But again, you can appreciate how that CMC capsule over the hamate encompasses both the fourth and fifth metacarpals. Again, you can see here the oblique and sagittal bands of the extensor hood overlying the MCP joint. Also the transverse retinacular ligament. Again, you can see the triangular ligament going distally. Also, you can appreciate the underlying joint capsule over each interphalangeal joint. And now we're going distally. We're removing the triangular ligament and rotating. Volar aspect of the fingers, and again we can see the accessory and proper collateral ligaments on each side of each interphalangeal joint. Good view of the volar plates as well, which are now removed. And now we're removing the radiocarpal joint capsule, and here we are left with the midcarpal joint capsule and still the CMC joint capsules, except for that between the fourth and fifth metacarpal and hamate. Also, you can appreciate the triangular fibrocartilage. We're removing now the wrist joint capsules as well as the CMC joint capsules, and we're just rotating now towards the dorsal aspect of the wrist. Now we can get a good idea of the bony structures of the wrist. And again, it's amazing how all these small bones interact with each other during the various motions of the wrist. Here we are now going distally. Again, we can appreciate the MCP joints. Now we remove the sagittal and oblique bands of the extensor hood, and now we're rotating to appreciate the volar aspect of the hand and wrist.